All right, so it is again my pleasure to introduce the amazing Cris Henderson, who is going to be talking about leveraging Pulse Point and explaining what Pulse Point is, and a new training module for community-based overdose response. And Cris, we have 10 to 15 minutes, so take your time or speed through it, or whichever way it's going to go. And then if there is any timing issues that come up, my friendly little face will just pop up on the screen to remind us to find a spot to take a pause.
Okay, thanks everyone. I'm really excited to be here to talk to you about the core training program. I'm going to first talk about, I'm going to provide an acknowledgement statement, then I'm going to provide some background about the core program. I'm going to discuss a few main findings from a 2020-2021 NIH study that we conducted here in Indiana. And then I'm going to wrap up our presentation today with actually some information about a core program that's going on right now in Dearborn County, Indiana. So if you want to know more about the development of core, how we got here, you can look up this study, the reference number here for NIH. And then I think we can agree that, you know, the pandemic has really been exacerbated. The pandemic has really exacerbated the opioid crisis, and it's really challenged our communities to think about overdose prevention and access to treatment and other services, I think, in new and innovative ways. And with 106,000 overdose deaths and 3/4 of those being opioid related, I believe one of the ways in which we can engage more people in overdose prevention efforts is through the Citizen Opioid Responder Program, which is a science-based online naloxone training program that I and another IU team member created. And one component of our training is that we talk about how we're leveraging technology that's being used in communities, in this case, the medical mobile app called Pulse Point, and how we're using that here in Indiana and how it can be used in overdose prevention. So I'm going to begin by talking to you a little bit about what Pulse Point is. This work really builds off some work that was first piloted in Clark County, Indiana, where the health department saw a real need to increase the number of people trained in CPR and also in naloxone administration. And then they were thinking, well, given that we're a rural community, how can we connect people in real time? And so they learned about Pulse Point, and they saw that that was a way to connect people in real time. And so they extended that technology to overdose prevention. And Pulse Point is actually used in over 4,000 communities in North America. And it was developed for the sole purpose of connecting people like you and I in real time to medical events requiring CPR in our communities. And in Indiana, we have counties that are using this for the first time in overdose prevention. So what sets our training apart from other trainings? Well, part of what does is that we developed the core training with some really important things in mind. First, it was important for us to understand what was being offered in the market. And so we ourselves reviewed almost 30 different online naloxone training programs being offered in the United States. And what I discovered is that overdose prevention programs, education programs, they vary greatly. You can get a naloxone training in 2 minutes and 2 hours and everything in between, and it varies in time and it varies in content. And this variability really helped me understand that a majority of naloxone training programs that are being offered to the public are solely focused on the transfer of knowledge. And so since our objective in our study was to engage a larger segment of the public in overdose prevention efforts, and we weren't specifically targeting persons in active use, we recognized that it was really important that we were mindful of where people were and what they were thinking and how they might feel about opioid use disorder and what stigmatizing beliefs they might have about that, and how we might create a training program that went beyond transfer of knowledge, but also in a subtle way help destigmatize the disease and also the use of Narcan in reviving persons. And so what we did is that through this training, we really wanted to test whether or not people had increased feelings of confidence, capability, and readiness, and also how many more might be willing to respond to a pulse point alert and render aid. So we tested this in 5 Indiana counties. We had 220 participants. We did leverage pulse point because it was offered in all those communities. And so just a little bit about the training. It's 8 modules. We took a multimodal approach to the development of the training and the content and the exercises. Again, that focus was thinking about how do we build people's feelings of confidence. And so what we did is we really rooted this training in science, right? So we rooted it in adult learning principles and Bloom's taxonomy. And we reinforced the learning process throughout, where we built in knowledge checks, we utilized videos and audio files. We really made the content interactive in that we incorporated matching and pop-out information. And we even incorporated guided activities in the training so that people were auditorily and visually guided through activities. So just a little bit about some of the results from the study. 136 participants actually completed the training. We had increased responses of people saying that they felt more ready and more comfortable, and also they found it interesting and attention grabbing. So just looking at that, just this statement here, since completing the training, I have enough information about how to effectively respond to an overdose. In this case, a majority of the participants either agreed or strongly agreed. Comfortability, a measure on that was how comfortable do you feel responding to a pulse point alert? And again, a majority of participants indicated they were either comfortable or very comfortable. And then we also looked at training, and one measure of the perception of training was how participants felt the training was designed. And in this case, a majority indicated they felt it was well designed. But another measure was a majority of individuals, in this case, 96% found that they strongly agreed or agreed that the training was interesting, and 94% agreed or strongly agreed that the training was realistic, and then 98% indicated that they thought the training was believable. So overall, just from the study alone, we found that participants did show increased knowledge, readiness, and comfortability, and the results were overall pretty positive. Now I'd like to turn our attention to some results that we've collected in a 6-month period about the study that the project that we have going on in Dearborn County. So just like the study, I really have a strong belief that you need to know your partners, you need to build relationships, and who's at the table matters. And so I strongly believe we really need to have key decision makers and community stakeholders involved in the process of implementation. And in this case, in Dearborn County, the health department was our lead partner. But then we brought in law enforcement, and we brought in the community health center and the systems of care folks. And the whole point is more people involved, it helps shape and inform what's going on in the community and cultivate that buy-in. In fact, this right here is a picture of the vending machine in the sheriff's department's lobby, where you can get free Narcan and you can sign up for free core training by scanning that QR code. So I'm going to talk a little bit about participants' knowledge, attitudes and perceptions, intentions, and some training feedback. So with knowledge comparison, what we did is we looked at 50 matched trainees' responses of pre and post data. And when we think about knowledge, we really want to see increases in the percentage of correct responses and decreases in the percentages of incorrect responses. And as you can see here, many program participants began the core training program knowing what that slow and shallow breathing and loss of consciousness were signs of an opioid overdose. However, only 50% of the trainees knew before core training that very small pupils were an indicator of opioid overdose. At pre-test, that went up to 96%. Most trainees knew how long Narcan takes to start having an effect at pre-test, so that was 84%. And at post-test, all of them responded correctly. In contrast, very few trainees, 28%, knew how long Narcan lasts before taking the core training, and that increased to almost 96% at the completion of training. Unlike knowledge, where we are measuring correct and incorrect responses, when we look at attitudes and perceptions, we're measuring that by degree. And so, for example, we don't measure people as confident or unconfident, but instead we ask how confident they feel. And among the 50 matched core trainees, there was increased perceptions that rescue breathing is effective in managing an opioid overdose after the core training compared to before it. Of particular interest, we identified that after core training, participants were substantially more likely to strongly agree that they could effectively reverse an opioid overdose without any additional training. We also found that participants were significantly more likely to report being very confident in administering Narcan intranasally to someone who has overdosed after completion of the core training compared to before. You'll see 92% here. Now, we also measured intention, and you might be wondering why. Why is that important? And when you think about what we're proposing, which is engaging more of the general public in overdose prevention efforts, we need to know where people are. And many behavior theories have shown that intention often precedes action. So when we want to understand what people might do in the future, we study their intention. So large percentages of core trainees with matched data already intended to carry naloxone on their person before attending the training. And because of that high baseline intention, that was affected, the statistical comparison was affected by a ceiling effect. In other words, although the change between pre and post test did not reach a standard of like 0.05 level of significance, 98% of the participants reported a 5 or greater intention, or 7 is extremely likely to carry naloxone after the core training. And then intent to respond to a nearby overdose, if notified, was also fairly high before core training. In this case, there was some evidence that participants had higher intentions to respond to an overdose after completion of core training. Interestingly, only 40% of the participants knew about pulse point before taking the core training. And so we're not surprised that that increased to 100% at the end. And the reason is because we have an actual module about pulse point incorporated into the training. I didn't include a slide here, but interestingly, 11 participants indicated installing the app for the first time on one or more personal device between taking the pre-test and finishing the training and post-test. Some training feedback. While prior data was based on group of 50 trainees where we matched the pre and the post-test data, this feedback was collected after the training only. Therefore, I've included responses from all 108 trainees. Feedback from core training was extremely positive. Out of the 108, we found that 103 strongly agreed that the training was worth the investment of their time, so 96%. 104 strongly agreed that they would recommend the training to others in their community, 97%. 102 strongly agreed that they were satisfied with the educational content of the training, 95%. And then 96 agreed that the length of time for the training was appropriate, 90%. And then 97 strongly agreed that the technology used in the training activities was appropriate, 92%, and 102 strongly agreed that what they learned from the training will be useful if they respond to an opioid overdose, 95%. So in conclusion, I feel pretty confident in being able to say that Our findings from the study and our current project in Dearborn County are extremely positive. We have participants that reported the training as being interesting and engaging. We have increased knowledge observed. We have significant improved attitudes and perceptions at post-test. And we also have evidence for improved behavioral intentions, such as carrying the naloxone and responding to pulse point alerts. So I open it up for questions and comments at this time. This right here is actually an example of our part of our marketing in the community, and this is my contact information.
Amazing. Thank you so much, Cris, that was, again, a lot of information. We have so many, data nerds and dorks like myself who love a good graph and love feedback. Those feedback mechanisms are essential to see if your postulations are doing. So building some really amazing evidence, and thank you so much for that. A couple questions in the chat. Where did they go? Someone would like to know how the police felt about participating. Was there any rough edges around that?
So, hey, I feel really good about the partners that I've built. First of all, starting with the health department, I worked for the state health department at one time. And so I really understand the importance of local health departments. And the local health departments have strong relationships with law enforcement and other first responder agencies. And in this case, in all of the counties in the study, we had all positive results, feedback. They were like, yes, bring this here. We need it. People are dying. And so even in the Dearborn County, we did not have any problems. That's not to say that in the 5 years that I've been working in overdose prevention, I haven't heard terrible things like, is this the best use of public dollars, right? Should we be Narcaning people? Compassion fatigue is real. And I've worked with other community partners that they're hearing this from their local people. And so this is something we deal with, right? We just are constantly providing information and helping to combat stigmatizing beliefs and bring people around, because they recognize, lots of different groups recognize that people are dying in our communities, and we have to do something different.
It sounds like, we've come a long way from people, in policing bodies refusing to carry naloxone.
We have many law enforcement and fire and EMTs all carrying Narcan in our state. So that's really being widely adopted.
That's amazing. There's one more question in here that I'm hoping we have a chance. So is there any training with intramuscular naloxone? Or was it all nasal?
At this point, it's not something that we can adopt the training to include that. We chose to go intranasal in this situation strategically. When we think about engaging the broader general public in overdose prevention, again, you have to meet people where they're at. And people get really nervous around needles. And so we were mindful of that, and we kind of tested that among community groups. And we found that was a little too much. That was too far. And so we didn't co-develop intramuscular along with the intranasal. But that is something I would like to visit, because I recognize that it's a need, right? And so I'm open to exploring that further.
Fantastic. Courtney has raised her hands. If it's very quick, you can absolutely ask your question.
Oh, geez, I'll try to keep it as quick as I can. Yeah, I just asked the intramuscular question because it just seems like in New Hampshire, they won't buy intramuscular naloxone through the state, and most orgs won't pass it out. And I hear from participants all the time that they prefer intramuscular naloxone. And I know that like Emergent Pharmaceuticals has possibly contributed to some of the, oh, it's using a needle, so it's scary. When in like retrospect, I don't know, like I have Crohn's, I had to self-inject myself with medication all the time. So, and like diabetics self-inject all the time. So like, I don't know. I
Yeah.
was wondering if you think that is like a maybe like overstatement of people being afraid of using syringes to maybe get a intranasal that is sold by a pharmaceutical company.
So let me address that. So it's important to know that we kind of informally pilot tested that question amongst friends and peers and so forth. It wasn't officially in our original study, but we did ask around. In Indiana, the federal dollars that flow down to the state health department fund intranasal naloxone. And then that naloxone is pushed down to the local health departments. And so the health departments are then distributing that to the public. And so that seemed like, because our target audience is more of the general public, and because we're partnering with health departments and they are the source of the supply, right? People complete our training, they get a certificate of completion, and then they can take that certificate of completion, whether digital or print, to take it to the health department, and they will give them naloxone. No questions asked, right? That seemed like the easier path to go, just because of how Indiana is set up, right? And who our target audience was. Yeah. I don't know if that helped, but that there's always room to adapt. And that's the thing about what we've created, is that we can add modules and based on who is wanting to adopt the training.
Amazing. So Courtney said that in handing out harm reduction supplies in the downtown east side, nasal goes really fast, even with people who are very comfortable with needles. Just because of its, smallness and efficacy.
Yeah.
So I'm so sorry. I know we have a lot more to talk about on this subject, but I definitely appreciate Cris. Can we give Cris a big round of emoji love? That would be fantastic. I am digging
Thank you all.
all the sparkling hearts. Thank you for your time today. Thank you so much. And for your work. Yay. Insert Kermit arms here. Okay, I'm going to stop the recording for 2 seconds, and then I'm going to introduce our next upcoming folks with the Naxos neighbors, long-term co-conspirators and collaborators. So excited to see what has happened over the past year.